We are following a concerning report that Catholic hospitals around the country are providing transgender drugs and surgeries to children, contradicting church teaching. A medical watchdog group called Do No Harm says nearly 150 Catholic hospitals performed gender transition surgeries or provided hormone therapies to children between 2019 and 2023. The report indicates that some 150 children had surgeries to alter their appearance to the opposite sex, and more than 280 children were given puberty blockers or hormone therapies which interfere with a child's natural development. The Catholic Health Association, or CHA, has criticized the Do No Harm report for, quote, irresponsibly presenting claims data without necessary clinical context. CHA did not contradict, however, any of the report's data. Dr. Joseph Meaney, Senior Fellow at the National Catholic Bioethics Center, joins us now to weigh in on this report. Dr. Meaney, why do you think so many Catholic hospitals have taken part in these transgender surgeries and hormone therapies?
Yeah, so the report indicated that in the 5-year span from 2019 to 2023, that 150 Catholic hospitals were involved in at least one transgender surgery or hormonal intervention. And basically, I think it goes to the lack of supervision and guidelines, that this was all very new, and individuals who were working for Catholic healthcare didn't have necessarily the intervention and the supervision and guidance to tell them that this was not allowed in a Catholic facility.
And could you tell us, what are the current guidelines from the Vatican and other church leaders on healthcare for those suffering from gender dysphoria?
Yeah, I mean, the U.S. bishops are very concerned about this. And so last year in March, they issued a doctrinal note on the moral limits to technological manipulation of the human body. And what they said there was very, very clear. Catholic healthcare services must not perform interventions, whether surgical or chemical, that aim to transform the sexual characteristics of a human body into those of the opposite sex, or take part in the development of such procedures. Also, Dignitas Infinita, a declaration from the Dicastery for the Doctrine of the Faith in April of this year, said that sex change interventions were also against human dignity.
That sounds pretty clear to me. And what do you think needs to happen in order for Catholic hospitals to truly follow the teachings of the Church?
So it's very clear that Pope Francis has condemned gender ideology many occasions, that they basically, Catholic healthcare cannot buy into that ideology. They have to have very clear guidelines that we want to support individuals who have gender dysphoria, help them to recover from that, but we are not going to encourage any kind of sex change, transgender intervention. And so that has to be in the guidelines. It has to be monitored. It has to be kind of just made very clear at all levels of Catholic hospitals that Catholic healthcare does not include transgender interventions.
Thank you, Dr. Meaney. And is there anything else you would like to add on this subject?
I think it's very important to say that, there are over 600 Catholic hospitals in the United States, and 150 of them over a 5-year span had a handful of these transgender interventions. So it clearly was exceptional. It wasn't like they were leading the charge on this, but it did show that they did not have enough guidance in place, enough supervision, and employees who maybe came from secular institutions to Catholic institutions thought they could do the same thing in Catholic healthcare that they were doing elsewhere. And so it has to be very clear in terms of the ethical and religious directives and elsewhere that this is not allowed. In fact, the bishops last year gave a mandate to the Doctrine Committee to put in transgender explicitly in the ERDs, the ethical and religious directives, to say, this is the guideline, you have to follow this.
Let's hope that this will give more clarity. Thank you so much for joining us, Dr. Meaney.
Oh, you're very welcome.